going through parenthood can be really an emotional roller coaster for any new parents and the entire family around that.
Helping you to understand what are some of the challenges that mothers and parents face, and what are some tips that you can apply to help you to work out your emotions as you go about this journey. At the end of my sharing, I will also be doing a guided exercise that all of us can do together. Stay tuned. We'll be doing an exercise together. And then after that, we'll be following up with a Q&A.
Today's topic is actually one topic that is actually very close to my heart because I experienced a job in my emotional health as a parent, and also as somebody who supports other parents, who supports other mothers and fathers. I'm able to be in the first-hand encounter with mothers and fathers who experience difficulty during going through parenthood, starting from the time they're pregnant and then giving birth to their baby, and then after that having to take care of newborn baby. It's a really can be really an emotional roller coaster for any new parents and the entire family around that. So without further ado, let me introduce our wonderful guest today, Sarah.
Hi, hello Gina. Good evening, everyone.
Okay, and yeah, she's a clinical psychologist and a mother of two beautiful boys. I'll let her tell you her story. Sarah, thank you very much for agreeing to do this Facebook Live with us.
All right. Thank you so much, Gina. And thank you everyone who's tuning in for being here with us today to share something that I know is very important to all, if not, a lot of you, right? As someone who's going through pregnancy, or perhaps in those early stages after your baby has been born, we know how difficult it can be during this time. And so it's, a great honor and pleasure for me to be here to share more about emotional health during this perinatal period. All right. So as you're reading the title, you might be wondering, what's perinatal, right? I've heard of prenatal. I've heard of postnatal. What's peri? Okay. So perinatal, to put very generally and very broadly so that more of us can feel related to this topic, is perinatal is basically prenatal and postnatal put together, right? So at any time during pregnancy or after giving birth, during those first year after giving birth is basically what the perinatal period is, all right? And so when we are expecting a baby, right, or when we get our baby for the first time, the kind of images or the kind of expectation that we have is this, wonderful, joyous, exciting time, right? And of course it is, right? But the thing is that there is a lot of expectation that it should look a certain way, right? I should feel a certain way. I should only feel joy, right? I should only feel excitement. Right. And a lot of the images that we get when it comes to pregnancy or being a new parent or a new mom are these kind of images, right? Where you're connecting with your baby, you're happy, baby smiling. And now I'd like you to imagine if on this page, on this slide, in the media, in, television, in magazines, that they really show, what motherhood or new parenthood actually looks like. How would this image be different, right? I have a feeling it would be tremendously different, right? There will be milk stains on the clothes. Mom will have her hair all over the place, tied up in a bun, right? Dad is probably struggling with the diaper, right? Baby's got, milk drool everywhere and the house is in a mess, right? The truth of the matter is that this perinatal period or postpartum period is extremely challenging. And I think that's something that we often dismiss or don't talk about often enough. Okay. And I was, sharing with Gina earlier that I've been a Tiban member for the past 7 years, right? So before I gave birth to my firstborn, moms in my group were sharing that you have to join this group on Facebook, right? And so I was so thankful that I did so, because it really encouraged me. It really helped me to not feel alone, because as I read through the questions and comments and tips, I feel like I get a real sense of, yeah, this is what motherhood or parenthood is. It's hard and it's messy and it's confusing, and that's okay. And I'm not alone. All right. So today this sharing will really be about helping you to kind of understand, right, what actually goes on during this perinatal period. What are some of the challenges that mothers and parents face, and what are some tips perhaps that you can apply to help you, to work out your emotions as you go about this journey. Okay. And at the end of my sharing, I will also be doing a guided exercise that all of us can do together, right? So if you're feeling particularly like stressed or tense or having difficulty relaxing, stay tuned. We'll be doing an exercise together. And then after that, we'll be following up with a Q&A. Okay. All right. So despite all of us kind of knowing that, the first few months or even during pregnancy, we all know that it's difficult, right? But oftentimes when I speak to moms, the question that I hear a lot is, why? Why do I feel this way, right? Why do I feel like this is so hard? And this is the answer, right? It's because we go through so many challenges as new moms, as new parents, right? There is a massive role transition that we sort of take for granted, right? We might feel like, oh, people have been parenting and birthing since the beginning of time. It should be natural, right? I shouldn't find this so difficult. But the fact of the matter is that it is, right? We have to readjust priorities, right? There are new demands. Our routine of, 9 to 5, I get ready in the morning. I drive to work, I go to work, all of those things get disrupted, right? It's not as simple as I wake up, I shower, I get dressed, and I'm out the door anymore. I wake up and someone's, latched onto me and I can't let go and I can't go to the shower, right? Or in the middle of the day, I'm pumping, right? Or if you are, regardless of whether you're breastfeeding or whether it's bottle feeding, it's, that having to wake up in the middle of the night to feed your baby. And whether you're a mom or dad, you will face these changes in your routine that can be very difficult, especially in those first few months to adjust to, right? There is a complete change of lifestyle where it's not just about you anymore, right? Or you and your spouse anymore, right? There's this little one now to think about. Right. And when we talk about feeding or nursing, like I said, there's that disrupted sleep. Right. So the first few days or first few weeks of, having to wake up every 2 hours to feed the baby, change their nappy, or they're crying because, they're uncomfortable. All of those things take a while, right? A really long time, really, to get used to. Okay. And so I think that it's only understandable that people might feel things like, extreme worry. How am I going to manage with all of this? Right? They might feel extreme fatigue, right? Might feel even some grief, right? About losing that sense of routine and schedule, right? And being able to do things that we used to do that it's not so easy for us to do anymore. Right. Another big challenge that new parents face is managing relationships, right? So the dynamic between husband and wife tends to change, right? When there is a baby, there is perhaps a lot of difficulty or expectation around parenting, whether it's between you and your spouse, you and your own parents, or you and your parents-in-law, right? All of those things now come into play. And it can be really hard to manage those things. So the bottom line really is that very few mothers feel great right after birth, right? It's very rarely that, oh yes, this blissful joy. And of course, we do get periods of that. But the bottom line is that it's really hard and a lot of people struggle, right? In fact, 30 to 80% of women report baby blues. Okay, so baby blues is really, any kind of feeling of just feeling really tired, right? You might feel worried a lot. You might feel just lethargic, just going through tearfulness, perhaps even in those first few days or weeks after giving birth, right? And actually, 1 in 8 mothers experience low mood and anxiety during pregnancy as well as after birth. Okay, so as much as postpartum blues or postpartum depression or anxiety gets a lot of attention, some women actually experience dysregulation in their mood during pregnancy itself. Okay, and so this is something that I think needs to have more attention, right? We need to kind of be aware of at what point is it the baby blues, right? Which might be because, we're lacking sleep. It might be because our hormones are changing or trying to restabilize itself after giving birth, right? But sometimes people can experience something more serious like postpartum depression or anxiety, where they might feel helpless for long periods of time, or they might feel like isolating themselves and not communicating with others. Okay, so these are things that we want to be aware of, right? And we want to try to prevent as much as we can. Okay, and I think one of the struggles that I faced when I first gave birth to my firstborn was that really there was lack of resources, right? As much as I was really thankful that, we had prenatal classes where you learn how to, like different ways to carry your baby, you learn how to change the diaper. We had resources to help us with breastfeeding and all of those things. There was and still is a lack of resources with regards to parents' emotional health, right? Lack of resources to understand what am I going through and how do I help myself during this period, right? We might go to the clinic, they will check our blood pressure, they will check baby's jaundice level, they will check, all those, kind of like your vital signs, right? But very rarely do they ask you, how are you doing, right? Yeah. Very rarely do they ask you, are you coping okay, right? So I think this is something that we really need to focus on, and I hope that it starts here and now. So, as a result of all of the stuff that mothers and, new parents have to go through, we might face a cascade of emotions, right? Like I said, feelings of grief, right? Feelings of worry or anxiety, just generally feeling like I can't handle it all or just feeling overwhelmed. Okay. So what I'm going to do now is I'm going to share a couple of tips, right? So just basic tips on what you can do to help yourself work through these emotions and help you to feel even just a little bit better during these challenging times. Okay. So I don't know about you, but when baby first comes, the idea is that what our schedule looks like is, okay, wake up, feed the baby, burp the baby, change the baby, shower the baby, wash all the bottle parts, and then try to put the baby to sleep. And it's like repeat, right? It's that cycle and really nothing else, right? It's all about chores, errands, and we forget that we need to do something fun too, right? We forget how to human, right? So first tip from me is to just try to increase something that gives you joy, right? Do something that you find, like when I do this, there's some kind of relief or it brings a smile to my face, right? And it doesn't have to be anything like huge, like going to the spa, right? It can be small things, like listening to my favorite song, right? And just sharing that song with baby, right? Or taking baby out for a walk. You might feel like, half an hour is too much. It's too hot, all of those things. But sometimes, just making a circle, right, around the house. 2 minutes, get some sun, get some air. You may not realize how that can actually shift your mood, even if by a little bit, right? And, sometimes when we're in confinement, we might feel like no mood to do anything, right? So one small thing we can do for ourselves is maybe put some lipstick on today, right? Something that can help me to feel more like me. Okay. So as much as we're doing that routine of taking care of baby and the laundry and the bottles and all of those things, try to add one thing today, right? That's just for you, that you enjoy. Number two, trying to find a balance, right? So like I said, as much as it's about responsibility, it can also be about fun, right? As much as our mind can sometimes think of all the things that we did not get to do today, right? For example, I didn't get to do baby's laundry today, right? Or I didn't put the baby to sleep in time. I didn't get their routine right, right? When we are, especially in those new stages, we try so hard to get everything right that we forget to kind of give ourselves some credit, right? So for everything that you think you're not doing properly, right? Remind yourself of one tiny thing that went well today, right? I didn't do the laundry today. The house is a mess today, but baby slept pretty well, right? Baby slept for 2 hours straight. That's great, right? Or I managed to wear some lipstick today and felt good, right? Or my husband and I got to eat dinner together. Okay. So as much as there are a lot of worried thoughts, a lot of feeling like I said, that we're not doing something right, try to balance that out with just one thing or two things that you felt went good today. Okay. So it's always important to try to do these things on purpose, right? Because that can help us to create healthy habits that can really benefit us in the long run and help us to increase our emotional resilience. So the next one, which I know is, repeated so many times, sleep when baby sleeps, right? And me, just as well as all of you, will say, no, I got to do the laundry when baby's sleeping. That's when, I can clean the bottles. That's when I can do this and that, right? But research has shown that when mothers get just 4 hours of straight sleep, right, that actually improves their circadian rhythm, and that actually helps them to get quality sleep that can actually improve their mood. Okay, so just 4 hours of straight sleep. And I can already hear perhaps some mothers saying, that's impossible, right? I got to feed baby every 2 hours. Okay, but remember that we're not in this journey alone, right? Perhaps you have a confinement lady or a mom or your husband can just help you to take over that one shift, right? And it can be at any time during the day, that's okay. Even if it's at night or, in the evening, that's okay too, okay? As long as you get 4 hours of straight sleep, right? And speaking of asking for somebody else for help, asking for somebody else to take over for you, it's so important to communicate, right? And when I say communicate, I don't mean, I already told him that when he did that, I felt so angry, right? I already told him that he was not doing it, right? There's a difference between saying that versus saying, I have asked, right? For him or her, to help me with this night feed, right? Oftentimes we wait until we're angry. We wait until we're so tired before we actually request for help. Okay. So we want to try not to do this. We want to communicate our needs beforehand, right? And we want to maybe even plan it early on. So sometimes even before baby's born, can we talk about what do we anticipate we might need, right? We might anticipate that I need help with the household chores, right? I need help with feeding the baby sometimes. So saying what we need is so important. And it's so important for us moms to remember that we don't have to be super mom, right? Super mom doesn't have to look like, yes, I can, nurse my baby and take care of the house and take care of my other children and take care of my spouse all at once. I can carry the world on my shoulders. It doesn't have to look like that. Like, I think we need to stop this idea that women can or have to do it all, right? I think we live in a community, we live in families, and it indeed does take a village, right? So I think it's important that women, that mothers, parents, figure out who's in your village, right? Who's in your little community that you can rely on to talk to to ask for help, or to just go to, to talk about your struggle. One of the things that I really appreciate about TBAN, or the Breastfeeding Advocates Network, was that I could see, parents or moms asking questions, asking for help, asking for tips. And it can be at any time during the night, right? It can be at 2 o'clock when I'm feeding baby, and perhaps I'm going through my own stuff. And then I look at Facebook, and yes, here are other parents who are struggling with me, right? And also having your own group, right? Perhaps other mothers, other people that right? Your own family that you can rely on to talk to, just to share about how things have been. Okay. And I know we might feel like if I tell people that I'm struggling, or if I ask for help, it means that I'm a failure, right? But that's not true. That is so not true, right? Those are just one of those things that our mind says to trick us, or that can sometimes, just bring us down, right? That's not true. That's not helpful at all. Okay, so that's something that we need to learn to step out of, and learn that it's okay to communicate, to express what I need. All right. So the last one, and which is our exercise for tonight, okay, is something that's called progressive muscle relaxation. Okay, so I don't know if, how many of you are out there with me, all right? But if you are there, I'd like all of us to do this exercise together, right, Gina? Perhaps you can do it with me as well. Okay, great. So basically, what we're going to do in this exercise is we are going to tense and then relax different muscle groups in our body, right? From our toes all the way up to our head. Okay. So just as an example, so using our hands, what I'd like you to do is I'd like you to squeeze your hands into fists like this. And as you do that, I'd like you to inhale and squeeze, right? So don't squeeze so hard that it hurts, but just enough that you can feel some tension in your fingers and your knuckles. Okay, so inhale and squeeze. So noticing that tension in your fingers, your knuckles, maybe your forearms, right? Holding that tension for a while. And then exhale and release. So what I'd like you to do is to just notice how the muscles feels like when they're tense, right? And how it feels like when it's relaxed. Okay, so now that you get the idea, we're going to start from our toes. Okay, so what I'd like you to do is to curl your toes in like this, right? So that they kind of point to the floor. So inhale and squeeze your toes in. So noticing the tension, perhaps in your biggest toe, maybe all the way up to your ankles and your calves, holding that tension there. And then exhale and let go. So one more time, inhale and squeeze. Holding for a while. And exhale, let go. So again, just noticing what it feels like when those muscles are tense and how it feels like when it's relaxed. Right? So now we're going to move up to your calves. So I'd like you to point your toes up to the ceiling so that you can feel some tension in your calves as well as your thighs. So inhale and squeeze up. Holding it there. Noticing that tension. And exhale, relax. One more time, pointing your toes up to the ceiling. Holding that tension there. And exhale, relax. So now we're going to move up to your thighs. Okay, so as you squeeze your thigh muscles together, your legs should naturally move closer together. All right, so just inhale and squeeze the thighs together. noticing the tension in your hips, your glutes, holding that there. And exhale, release. One more time, squeezing, hold, and release. So now we're going to move to your stomach. So remember that especially if you are pregnant, to not put so much strain or tension in it, right? Just move it slightly. Okay. And also if you're recovering from any surgery or anything like that, go easy on this one or skip it. Okay. So inhale and just tighten your stomach a little bit, right? And perhaps you might feel a nice stretch in your back. Okay. So just holding that there. And exhale, release. One more time, inhale and squeeze. Holding it there. Exhale, release. Now we're going to go back to your hands like before. So inhale and squeezing them into fists. Feeling that tension in your hands, your forearms. And exhale, relax. One more time. Inhale. And exhale, relax. So now up to your shoulders. So I'd like you to just move your shoulders as if you're trying to touch your ears. Again, not so much that it hurts, just enough to feel some kind of tension. All right. So squeeze up. Hold it there, feeling that nice tension or stretch. And exhale, release. So a lot of us tend to carry stress and tension in our shoulders, right? So I find this one particularly nice. So let's do it one more time. Inhale and squeeze up. Hold. And exhale, relax. And the last one is your face. Okay. So we're going to squeeze everything to the center of our face like this. Right. So you can feel a tension in your forehead, your cheeks, and your jaw. All right. So let's all do this together. Squeeze. Hold. And relax. Last one. And relax. So Gina, how's your body feeling after this?
Somebody is going to take a shot of us with our face and put it into a meme.
Oh no.
Make the body feel looser.
Yeah. Yes, looser, right? So I hope.
Part, yeah.
Yeah.
The shoulder part.
Excellent. So I hope that's helped you to just, kind of loosen up, right? Or to relax.
Yeah.
Especially if you're feeling particularly tense or stressed out, right? So progressive muscle relaxation has actually shown to help mothers improve their mood, right? And it has also shown to be helpful for people who have difficulty relaxing at night or difficulty with their sleep. All right. So this relaxation exercise is also, can be one of those things that's part of the pleasurable activities that I talked about earlier. Right. So remember that it doesn't have to be something long or lengthy. Right. Sometimes the people I work with might like to do just one, like if they like the shoulders. Then sometimes when they're feeling like, oh, I'm so stressed, I had so many things to do or so overwhelmed. All right. So remember that these tips can be helpful. And if you're looking at all of them and you might feel, I may not be able to relate to this, or I might not be able to relate to all of them, right? But just being able to do one thing differently, right? Even if it's 1% better than before, even if it's just like 5 minutes of doing something differently, that's enough. Okay. Because 1% better or 5% better than yesterday, if we accumulate that, it will add up. It will make a difference in the long run. Yeah. So, as I was saying earlier, in Malaysia, there are a lack of resources. We go for prenatal classes, we go for all kinds of classes and talks about health, right? But there's very lacking information about how to take care of ourselves emotionally or mentally. Okay. And as you were looking through some of the tips, you might be feeling like, I don't know how to communicate, right? Or I don't know how to take care of myself. I don't know what I like, right? So what we plan to do at Relate is we are developing a program that can actually help mothers to increase their skills, basically, to help them to get the support that they need during this perinatal time, all right? So some of the things that we might work on are helping you to understand your needs, all right? How to communicate better, how to figure out who's in your village, right? What are your resources, and how you can learn to be assertive, to ask or to request for something that you want, right? So if you feel like this is something that you're interested in or that you'd like to know more, here are our email addresses that you can reach out to. Okay. So I think last but not least, before we go into Q&A, what I would just kind of like to repeat is that if we can just do one thing differently, right? Even if 1% better or 5% better, that can make so much difference in the long run. Okay. So I hope that the sharing and the tips today can be helpful for some of you. All right.
All right. Thank you so much, Sarah. It's really eye opening over a few things. Yeah. I am satisfied because this is, I think, maybe the first time I look at it that way, or I've been told that way, that the change to motherhood or fatherhood to parenthood, yeah, we are a new baby, that there is a sense of grief. Yeah. Sense of, I think we don't look at it this way, because when we talk about grief, we always look at it as something that's bad has happened, and we would not like to acknowledge that we are in grief. Yeah, over this. But how do we think this understanding? Understanding that I've lost something, but then I feel selfish to think that way, that I gained a new baby, but then I feel selfish to feel that I've lost my freedom. So maybe, or so I think it and come to terms with it.
Yeah, that's such a good question, and definitely something that's true for a lot of us, right? When we talk about this grief, we might feel like grief is only applicable if you've lost something or if something bad happens, right? How can something joyful, how can an addition to the family be related to grief, right? But the fact of the matter is that we do lose part of our identity, right? We might lose part of our identity as somebody who, is free to do these things. We might grieve activities that we used to do. We might grieve relationships or closeness in relationships that we used to have. Sometimes even if you have already had a child and you have a second child, you might grieve the change in your relationship with your firstborn, right? And so, yeah, it's very easy for us to kind of fall into this trap of thinking that it should be either or. Either I should be happy or sad. But we can feel both, right? We can feel grateful and thankful that we have a new addition to the family, right? That we've been blessed with a baby. And I can also feel sad. I can also feel a sense of loss of the person that I used to be. Right? Or of the life that I used to have. It doesn't mean that I necessarily want that life back, right? But it doesn't mean that it's not hard to lose it, right? So I think take acknowledging that this has happened, acknowledging that we feel that way, and trying as much as we can to avoid judging ourselves for it. Taking a kind of more open and compassionate point of view where you can feel both.
Thank you very much. I actually had somebody WhatsApp me because he says he doesn't want to write it in the comment section because it's sensitive.
Yeah,
She
sure.
say that she say how after the baby has arrived, my husband has not been the same. She say, okay, and he is totally engrossed. Maybe it's her fault. Maybe it's my fault. I've been totally engrossed with my baby, and my husband doesn't seem to want to have anything to do with my baby. I'm wondering if postpartum depression. Sorry, I'm wondering if men suffer postpartum depression as well, or is it something just mothers suffer from?
This is such a good and important question, right? So that's why also I try to be as mindful as I can today to say parents, right? Instead of just mothers. Because yes, fathers do go through postpartum or perinatal depression, right? It's just that it's not as well researched or well established. It's something that, people have just started to look into. But yes, research does show that fathers do go through depression and anxiety during this period as well. Okay. And we might perceive it as they are isolating themselves, or they don't love me anymore, or they, of course, we tend to mind read, right? Especially if us ourselves don't feel so good, right? We will think of the worst case scenario, right? But I think it's important to have awareness that this does happen. Okay. And what we can do is perhaps talk about it, right? Like I noticed, and not in a kind of blaming or accusing way, but like I noticed that you've been distant lately. Are you okay? Right? Just as simple as that. Are you okay?
Is there anyone who can only can go for help? If let's
Sorry?
say, most men, they will say, if you say, "Are you okay, darling?" I've noticed that you have been distant, and perhaps the hubby will say, "Yeah, everything is fine." And then, although like what this mom said is saying that things are obviously not fine, and of course, it boils down to their level of communication and their level of openness to each other. So, okay, let's say that you say it's not fine. So, where do they seek for help?
Okay, so if dad says he's not fine, that's great, right? That is the first step, because
Yeah.
he's acknowledging that, okay, something is definitely wrong or doesn't feel right. Okay, so first we want to gather some resources, help both dad and mom to understand what might be going on, right? What are some of the things that men do go through during this period of time, right?
Mhm.
Helping him to feel assured that it's normal, it does happen.
Right.
Okay. And then seeking help, right? There are counselors, psychologists out there. So you can, look up for those who are, nearby your area, right? There are also online services these days that you can go to.
Okay. I guess, yeah, acknowledging and being aware and taking the first step is like the most important, yeah. But I think that the next question here, yeah, is we hear about baby blues a lot. Baby blues, is it the same as PND, postnatal depression?
Okay, so baby blues are something that might more commonly occur as a result of going through these changes of your hormonal changes, getting used to not getting enough sleep, right? Getting used to hearing baby cry, all of those things, right? So it's something that occurs as a result of all of those things, and
Yeah.
it's general feelings of like overwhelmed or tired, right? Whereas postnatal depression, right, may come with feelings of wanting to isolate yourself, right? May come with feelings of finding it difficult to connect with baby, right? Will come with very overwhelming thoughts of feeling like I'm a bad mother, or I can't do this, right? So those are all the red flags that might signal to us that this is something more than, regular baby blue, right? Or difficulty adapting, right? So regardless of whether it's baby blues or depression, I would say get help, talk to someone, right?
Yeah, because in my line of work, I see new mothers all the time, and when I suspect baby blues, postnatal depression, I will always tell them please to get help. So I have several cases of mothers who listened to me and they went back to their doctor, to the gynae usually, or to the hospital, and unfortunately, the doctors will usually tell them, "Oh, you're just experiencing baby blues. You'll get over it." Yeah. Do you think that it's actually? I don't think so. But do you think that's the correct thing to do? But I may be wrong. That the doctor should just let them get over it.
So even when I hear the term like, get over it, it's already like,
So,
right? So even though, baby blues is more common and not as severe or serious as depression, acknowledging that it's there and trying to do something about it can prevent it from then developing into postnatal depression, right? So I think it's important that if you are struggling to get help, regardless of what it is, significant disorder or not, right? If you are feeling down and if you are struggling, then it's valid for you to voice out, to talk about what you need.
all right. Because some mothers they're covered under insurance, so they will actually go to their gynae first, then they get referred to a clinical psychologist or psychiatrist or whatever, right? So that is the place they want to go. Is it possible if I were to refer the mother straight away to a clinical psychologist or a psychiatrist? Is that the proper channel to do so?
Um, to be open and honest, I would say yes. I would say if we're already observing that mom is struggling, she's going through these kind of up and down mood swings, right? It may be helpful to just speak to a counselor or a mental health professional already, because I would say let's normalize it as much as we can.
Yeah. The next thing is because what was an experience with my third baby that was 23 years ago, this year is 23. When I just get birth, I felt it, because I'm aware of what PND is, what baby blues is like, and when it's my third baby and then I have two older babies to take care of, I do feel the crash of emotions and the overwhelming feeling that I'm losing it. And then I talked to my doctor in the hospital, and he was very sympathetic. He was like, okay, I see that you're going through a hard time. I'll give you something. I said, do you want to take something? I just said, yes, please give me anything. You're not desperate. So he gave me B complex. He gave me I recognize what is it. I just said, why is it B complex? He said, yes, it's very good for you. Take it. Okay, so I took the B complex and a lot better. Is there a link between B complex and all this emotion crashing and instability?
I would say that there is definitely a link between our physical health, of course, and our emotional health, right? So if we're not getting enough nutrition, how I see food and vitamins is that they nourish not just our body in the physical sense of our energy, but it also nourishes our brain, which affects our mood, right? So yes, sometimes supplements can be helpful to help us to feel better, to regulate ourselves, but they may not be they may not work, or they may not be enough for everyone, right? So different people, yes, correct. Different people will have different needs.
I remember, but this is so many years ago, 20 years ago. I remember taking the B complex, listening to my doctor, and I felt a lot better. But then the mood swings are still there, and the sense of helplessness is still there sometimes. But then I have to tell myself, I have 3 kids now. I have no time to get sick. That's how money pass. Yeah. So, and also being aware is very important. Awareness that, hey, if I continue this way, will fall into deeper and deeper hole, and then into an abyss that I cannot crawl myself out from. So, for me, that's my personal experience. I find that talking to my doctor helps, him giving me the complex help, and also personal prayer time, and of course, having a village really, really does help.
Yeah, thank you, Gina, so much for sharing your experience.
So that is something that the feeling of despair, of despair, and it's very like no, we cannot go there, But it's just that it's a strong pulling force. So I know that I didn't do it alone. I knew that my village helped a lot, and I think that's a message for a lot of people here. Those of you who are with us, some of you are live with us, and some of you will be watching this afterwards at your own convenience. Yeah. That I hope that if the message reach out to you, that you are not alone. Yeah, mummies and daddies, and sometimes grandpas and grandmas too. Yeah, you are not alone. We are here to support you, and there is a fantastic organization now. Relate. I'll put the link up. Okay, I'll put the link up. You can like them on Facebook, and then you can straight away contact them. I'm very, very sure that they will be more than happy to reach out to you, and they are very what do I call this? Privacy is very important, right? Especially when it comes to Malaysians or Asians, they're very private people. We do not want the whole world to know about our problems until maybe we overcome them. Okay, and then a lot of us really need extra support. Yeah, and I do hope that you will not just suffer alone. Yeah. So let Renee help you. Sarah is there, and her entire team. They are very well trained. They know exactly what to do. They know exactly how to help you get through this wonderful and yet overwhelming phase of your life. Yeah. So, Sarah, any last words
Oh,
before
wow.
I let you?
I feel like you've summed that up so beautifully, Gina, right? I mean, I think that message of it taking a village, right, of gathering your village people is something that is so powerful, and I think so important to remind ourselves that we don't have to do everything alone, that we are not alone, and it's okay to reach out for help.
Thank you so much, Sarah, and mommy and daddy. Iban and your village. Yeah, even at 3 o'clock in the morning. But perhaps at 3 o'clock in the morning when you're typing your message, you didn't approve it yet, but know that your message will be read by somebody the next day as soon as possible. Okay, and then you scroll through all the story sharing and look for all the wonderful stories that other people have shared. Okay, to Siban members as well. May I request that you not only ask questions for your problems, but those of you who have no problems but have very happy news to share, encouraging words to share, please do share it so that a mom or a dad who's awake at 3 o'clock in the morning read it and feel encouraged. All right. So thank you so much, Sarah. Yeah.
Thank you so much, Gina.